So I'm wondering if you've seen any trends related to different demographics. For instance, I know that with different diseases like breast cancer, people who are of different origins respond differently to the same treatment. And I know that for breast cancer, for example, methylation changes how people respond to treatment. So I'm curious if you've seen anything similar in the world of psoriasis when you're treating patients. Parallels.
Well, I haven't really seen differential responses that I can recall. We're not even talking about kids here because the numbers are small. We're talking about adults. I haven't seen really differential responses. The biologics are so powerful, and right now the ones that come out are giving to such high are giving such high numbers with PASI 90, PASI 100 that they really are working across all different kinds of races and ethnicities. However, there is evidence, first of all, epidemiologically, why do we see psoriasis much more commonly in whites than in African Americans? That's not answered. There's also been interesting data coming out just about skin biology being different. For example, TNF alpha being increased in those who are Black, just looking at samples from people without skin diseases, and also the fact that there may be a greater severity, even though there's less frequency in those who are African American. So there are some hints that this would be very valuable to look at.
Yeah, that's interesting. That greater severity but lower incidence thing is a common trend, I think.
And differences in cytokine expression in baseline skin.
Yeah, I'm always wondering about that because even now we're looking at microbiome and research a lot and how it's passed down along family lines and even to the point of the brain obviously having its own microbiome, and we're barely scratching the surface on how that might impact mood and different mental health disorders. So I'm wondering how microbiome might impact psoriasis. That's really interesting. I'm curious to know what you think are the biggest roadblocks to increasing clinical trials among pediatric psoriasis patients.
Well, one of the greatest roadblocks is that psoriasis is not a common problem. It may be among our most important ones to recognize, but it still is in less than 1% of the population. And I think it's kind of interesting to understand that when you look at what adults report in terms of their onset, if we say 2 to 3% of the population of adults has psoriasis, and about a third of them will report having their onset during childhood, if you do the math, that comes out to pretty close to 1% or maybe a little bit less. But if you look at the database data, consistently we're talking about 1/10 of that. What's the disconnect? And I do think it's the fact that it's only recognized later that that's what it was. So we need to do some work there in better understanding that. But that is a roadblock. There are roadblocks in general with pediatric research because parents are very protective of children. Uh, no question, you're doing a study, you're going to have blood draws. Now, that may fly with some serious diseases, and psoriasis is one that is a serious disease, but not in the same way, for example, as some of the other diseases that kids get that are chronic diseases. So there's concern about taking kids out of school. There's concern about doing things that may be traumatic in a study. There's concerns about the fact that to have a good study, you got to have a placebo arm. And that's probably one of the biggest roadblocks that I face in trying to recruit people is that I know I can get them something to treat right away. It may not be my first choice, but I can get them something. So convincing a parent to let their child go on for months on a placebo in order to have the chance to be on something that may be better, or then continuing on that in an open label component is a bit of a challenge.